Hello, and welcome to Breast Cancer Conversations, a podcast brought to you by survivingbreastcancer.org. I am Laura Carfang, breast cancer survivor and founder of survivingbreastcancer.org, a nonprofit organization providing community, education, and resources to empower those diagnosed with breast cancer and their caregivers from day one and beyond. Hello, my friends, and welcome back to another episode of Breast Cancer Conversations. Today, we are talking about something that almost every cancer patient experiences, but very few people prepare you for. It's not the diagnosis, it is not the treatment, but the medical bills, the insurance denials, and the paperwork that come with it. For many of us, the financial side of cancer becomes its own battle. Claims get denied, prior authorization delays treatments, bills arrive and make no sense, and suddenly you're expected to become an expert in insurance, coding, and appeals. How do you navigate a system that feels impossibly complicated? That's exactly what we're going to unpack today. Joining me is Jenni Nolan, a board-certified patient advocate and the founder of Clear Healthcare Advocacy. Jenni has spent more than 20 years working inside the healthcare system and now helps patients across the country resolve insurance disputes, fix billing errors, and fight denied claims so that people like us can focus on what's most important, our health, not the paperwork. Welcome to the conversation.
My name's Jenni Nolan. I am a board-certified patient advocate, and I am coming to you from lovely, freezing cold Carmel, Indiana. But I help patients across the country who are overwhelmed with medical bills and health insurance claims and all that good stuff. So I started my business about 6 years ago as an independent advocate after working for 20-some years out in the medical field on the business side. So I was an office manager for an OB practice, and then I managed a counseling practice. And through those two jobs, I became really familiar with the medical billing process. What started with me trying to chase down money on behalf of our doctors turned into my realizing that, hey, not only are we not getting paid correctly, but we're then not billing our patients correctly. And then I started noticing at home that a third of the bills that come into our house, and we're not like sickly people. I've got 4 kids, but we do things. They would be incorrect. And I would get these bills and I would say to my husband, oh my gosh, if I weren't here, you would just be writing checks for these bills, because he doesn't know anything about the medical billing process and he hates to owe people money. So I started thinking, what about all these people who don't have someone like me who can take the bill, research the problem, and get it resolved? And that's when I started researching patient advocacy back in about 2018. And lo and behold, it is like an actual thing with a real certification. So it's through the Patient Advocate Certification Board. And we're kind of divided up between patient advocates that you might hire to help you navigate the clinical side of your diagnosis. So you've just been diagnosed with breast cancer, let's say, and you're so overwhelmed, just, researching treatments, coordinating appointments, having the doctors talk to each other. You could hire a patient advocate to take that on for you. And then there are people like me who strictly do the billing and insurance side, and you don't want me at your bedside. Promise. But so we kind of fall into 2 different categories there. So I've been doing this, like I said, since 2020. I absolutely love it. But I learned early on that I really love working with cancer patients, because cancer patients are so overwhelmed with their diagnosis, are so concerned with just treatment and what do I have to do to stay alive at the beginning, that when those medical bills start coming in, they either start writing checks and paying them, whether they owe them or not, or they put them in a big pile to save for months down the road when they can deal with them, at which point some of them have already gone to collections, and maybe some of those that have gone to collections you never actually owed in the first place. So I love to just come alongside cancer patients and just take that off their plate.
Amazing. A couple of questions right off the bat. At the billing phase, when you go in and the doctor puts some sort of code into some system that gets triggered to go to an insurance company, maybe you could walk us through actually like how the system works. And then my second question is, okay, then once we get the bill delivered to us, how would I even go about analyzing that bill to ensure that it's correct? As you're alluding to, perhaps there are incorrect charges that I wouldn't even know are on the bill.
Correct. Yeah. So you can, if you just go out there and Google it, you'll find numbers between 30 to 80% of medical bills have some kind of error. Now, to get to 80%, you'd have to really go digging in the weeds. Like I would have to say, oh, here's Laura's medical record from her inpatient stay. Did she really have 2 aspirin like they're billing her for? And so usually you don't get that involved. I'm sure if you did, you'd find that 80% of them have errors. But we can assume, like I said, for the ones even that were coming into my home for just routine like ear infection, things like that, 30% of them have some kind of error. So I always tell people it starts even before that diagnosis code is entered, like you said. It starts the moment that you call the doctor's office and say, I have XYZ insurance. Do you take this insurance? Right. And so the opportunities for error start there, and then they just are infinite. So let's just say you call and say, I have Cigna. Do you guys take Cigna? Oh, sure, we take Cigna. I mean, most doctors do, at least in the region I'm from. Well, now we have the marketplace for people who are getting insurance through healthcare.gov, and there might be a Cigna policy out there, but those have really narrow networks. So your provider, Dr. Smith, who takes Cigna, might not be contracted through the Cigna EPO, that is your state policy. So, and the people at the front desk don't know that, and you, the patient, don't know that. And so there we go. All of a sudden, we've got somebody out of network and all the problems that come along with that, right? So yes, then there are coding errors. You walk in and you say, I have new insurance, but you know what? The girl just wasn't really feeling like doing her job that day, and that new card didn't get entered. So they're still billing your insurance that you had 2 years ago or whenever you last went into the office. There's coding errors. There are duplicate charges for things that were going to happen, but then they didn't actually happen, but you ended up getting charged for them anyway. I mean, the possibilities are endless. So I always tell people when that first bill comes in, first of all, don't pay it until you have researched it. So you are going to want to pull up your explanation of benefits. And a lot of people don't even understand what that is. In the industry, we just throw around the word EOB. So pull up your explanation of benefits from your insurance. They might come to you in the mail
right now. Okay. So okay. Explanation of benefits. I hope all of us are like writing this down, also known as EOB. So this is where we can go in, log into like whatever portal that gives us our insurance information. And that's where we can go and kind of see like what is covered.
The EOB is going to show you what your insurance did with that claim from insurance. So let's say you go in just for an office visit, your first office visit, right? You've just been diagnosed. You're going in for your first visit with the oncologist. You're going to get a bill for that visit. And when you get it, you're going to want to go into your portal, or if you're getting them through snail mail, which a few people still do, make sure that you have that explanation of benefits and match them up. Does the total that your bill is saying that you owe match the total that your explanation of benefits says that you owe? And if they don't match, you've got a problem. And then, sometimes maybe they do match, but you also want to look at that explanation of benefits because it's going to tell you if any line items were denied. It'll tell you if you accidentally went out of network. So you get a whole lot of information from this explanation of benefits. And it's funny because when I talk to people, they're like, oh my gosh, I just throw those in the trash. Like when we used to get them paper, like either I don't ever look at them or I just throw them in the trash. And I literally, like, my skin is crawling when I hear that because it's such an important piece of paper. Also, if you get a bill and you go into your portal and you can't find an explanation of benefits for those charges, there's a good chance that insurance never even received the claim. So you're getting billed for the original amount and they haven't even done anything with it. So that's another reason why you want to look for that document. If it's not there, then maybe insurance didn't even get billed.
My jaw is dropping. I'm like one of those people who I think throw everything in the trash because you also get to say like, this is not a bill. And then it explains everything.
Yeah, it's not a bill, but it explains everything that you're going to get on your bill and they need to match. Yes.
I can't, says no one ever. I can't wait for my next bill, but like I'm going to go through this process.
So exciting, isn't it? You can geek out.
It is. Okay. So point number 1, make sure that this explanation of benefits matches the bill that I am getting. Yep. All right. And then if it matches, this is great. I go forth and I pay the bill.
Yep.
If it doesn't match, what do I do?
If it doesn't match, then you need to start digging in. And it should, if there were any denied charges on the EOB, you want to see, what was denied. And it could be 1,000 things. Like I said, they're infinite, but you should have an explanation on there. And then you need to start researching. Was it something that you thought would be covered by insurance, but it didn't end up being covered, in which case you can appeal? And a lot of times when stuff is going on, they're still matching, right? Like the insurance, the EOB will say, you owe $5 million. And your bill says that, but that's because insurance has denied something, right? So they might still match, but you just need to go line item by line item under those denials and see what's going on. Was it out of network, but it should have been processed in network? Or oops, are you one of those people that made the mistake that I spoke of before, right? Where you've got a healthcare.gov account and your provider's not actually contracted. So appeals are big. Again, you're going to look for like duplicate charges that might have been denied. I have twin boys and they both got circumcised as infants. And I got a bill from the hospital and insurance had paid for one circumcision, but denied the other one as a duplicate claim. And I was like, oh no, these are two separate penises, two separate children. But again, I was like, oh my gosh, my husband would have been like, because it wasn't super expensive. So he would have just paid it. And I'm like, no.
Yes.
That's a different child. So, I mean, the possibilities are endless.
Wow. Yes. Real life scenarios here.
Yes.
So another question that I think comes up a lot for us, especially as patients, and at what point or where and when do we start asking for how much is this going to cost, right? I go and I see my doctors and they're ordering all of these tests, these scans, this blood work. And obviously they're not the ones who are like, and this is going to cost you $12,000. And I don't want to deprive myself from having these tests as well that are going to help determine my treatment plans. Who in the hospital system or my insurance company are like, at what point do I say, okay, how much is this going to cost me so I'm not sticker shocked later?
Exactly. Yeah. And that is huge. I will say a lot of my practice is negotiating down balances after everything's gone through insurance, because sometimes it's just right. And we've all got these high deductible health plans now where you get your bill and you're like, oh my gosh, thousands of dollars. And it's right. It's just expensive. So I end up having to go negotiate with hospitals or providers. And price transparency is turning into a huge thing right now. And I am super passionate about it. Hospitals are supposed to list pricing on their websites, but I don't know if you've ever tried to find it. You can do like a price estimate, but they're only required to do like a certain number of CPT codes out there. So if you happen to know what that procedure code is that you're looking for, you can maybe get a price, or you can find their standard charge lists, which I do all the time as an advocate. I wouldn't recommend it to just, the lay person, but it's basically a spreadsheet usually or a JSON file that will nearly crash your computer when you download it. And then you have to go through and try to extract these CPT codes because they're not advertising the information, right? So I'm huge about price transparency, but I think that as patients, we have not been taught to ask these questions up front. Cancer or no cancer, when was the last time you asked what your visit was going to cost before you went to the doctor? People don't do it, which is weird because we care about the price of bread, we care about the price of our gas, we care how much our haircut is going to cost, and then we've got these expensive things that we don't even ask about.
And you're putting the patient in a really hard situation too, where it's like, okay, now I'm asking, now I know. But now am I going to deny myself
exactly
these treatments that are ultimately like life prolonging or life saving?
Yes. But at the end of the day, you should have that option to weigh those pros and cons, right? So I would just say be very upfront with your providers. Like you said, they're not the ones, they don't have a spreadsheet back there. I used to tell one of the doctors that I worked for, a patient would come out to the checkout desk and say, Dr. So-and-so said this was going to be covered and it would cost XYZ. And I'd be like, I would go back to him and say, stop talking about the patients about prices. You have no idea what you're talking about. They really don't, which is great. Like they're there just to provide care, right? But there is a business office and you should not feel bad or awkward or cheap for asking how much something is going to cost and is it going to be covered by your insurance? So I say be upfront. And a lot of oncology practices, I know, I'm a part of a few different forums where they do have navigators now, like on staff. They're worried about this stuff, like social determinants of health. Like, okay, if even if you can pay your bills, are you still going to be able to pay? Are you going to be able to pay your electric bill, or, are you going to be foregoing groceries so that you can pay this doctor's bill? So they really are paying more and more attention to that stuff as healthcare has gotten more and more expensive. They have to.
It's so infuriating.
It is. It is. And trying to get those prices is very hard, because the way the whole system works is based on like codes, and, who knows those codes. And, your insurance is supposed to also be able to tell you how much negotiated rates are so that you can figure out what you're going to owe. But I have a really hard time getting that information from them.
So how you referenced a couple times being able to like negotiate lower rates with the hospital directly. Is that something that patients can do themselves?
They can. Yeah. Yes, for sure. If you are dealing with a hospital system that happens to be a nonprofit hospital, they are required to offer financial assistance. And most people don't understand that because, again, the hospitals aren't like openly advertising it. So if you get a paper bill and you flip it over on the back, in microscopic writing is all the information about applying for financial assistance.
Okay.
But even if you call the billing company and you're like, oh my gosh, I can't afford this bill, they're not going to say, okay, apply for financial assistance. They're going to say, well, we can set you up on a 12-month payment plan or something like that. But if you're being seen at a nonprofit hospital, they are required to offer financial assistance. And that financial assistance is often more generous, I think, than people believe. Like, you don't have to be on food stamps to qualify for at least partial financial assistance. And I always tell people it doesn't hurt to apply. For one thing, it kind of slows down the billing process because they're not allowed to send you bills while your application is pending. So it kind of buys you a little time there. And then it's kind of like a hoop that you have to jump through so that if you are denied, you can say, okay, hospital, I still have this huge balance. I tried to apply for financial assistance through your application process and you denied me, but these charges, I still can't afford them. So what can we do? And I use that a lot when I'm negotiating. And this is where it gets complicated because you can't really negotiate a bill just on like, I think $500 sounds great. I'll do that. You have to do some research. So I go out and look at Medicare pricing. What would Medicare pay for the same services? And then there's just kind of this industry rule that we use that's like, let's offer between 150 to 200% of Medicare. And if a hospital's nice, then they'll go with it. But negotiations are interesting because it also depends on who you get and what kind of day they're having. Literally, it's so subjective. But you can do it. So I encourage people to do that.
Thank you. That's great advice.
You could call a place and say, this is the therapy I've been recommended. Can you give me a good faith estimate? And then compare those two. And then, if you end up getting bills that are outside of that, then hold them to that good faith estimate and say, what went wonky here because here's what you told me. But, if you've got insurance and hopefully your treatment is covered, you should just only be worried about that out-of-pocket max each year. That's the big number that you want to worry about.
So in theory, if you save for that out-of-pocket max, you don't go over that usually? Is that?
So if everything's going correctly, let's say we'll just use some made up numbers here. Say you have a $2,000 deductible and a $5,000 out-of-pocket max if you go in network. You know that if you go in network and you are doing therapies that are covered by your insurance, you're going to pay $5,000 that year. And if you start getting bills outside of that $5,000, then you've got an issue. Then maybe you ended up out of network somehow, or something was denied that didn't get applied to that out of network. But I think that's a good thing to keep in mind when people are shopping for new insurance for the next year. If you are in a place where you get to shop, like sometimes employer plans will offer you 2 different levels of plan, or you definitely have multiple levels if you're shopping on healthcare.gov. What is that out-of-pocket max? Because if you're in active treatment for cancer, you're going to hit it. So At the end of the day, it's all down to just like dollars then, right? Plus, what is my out-of-pocket max? And that's your maximum exposure for the year.
Super helpful. So many of us, unfortunately, do get denied life-saving treatments.
Mm-hmm.
And I know in our circles, we're like, oh my gosh. And I know I'm not preaching to the choir here where it's like, how is this insurance company, needing to fight with my doctor who is medically necessary. How can you help us understand some of this like jargon? What is considered medically necessary, or when we are denied, how do we go about appealing these claims?
Yeah. So I would say different insurance companies have different criteria for what is medically necessary. They're all the same ish, and you have to jump through those hoops, right? Like maybe they'll cover a certain therapy, but not until you tried this, that, and the other one. I would say if you are ever denied, appeal. There are statistics out there about the number of people who actually appeal denials, and they're very low. But the number of people who win an appeal if they do it are actually really high. So a lot of times the insurance company is banking on you not appealing. So I would say if you get yourself where you need to appeal, and especially if this is something that your doctor has recommended for you and feels is absolutely necessary, peer-to-peer is your best shot, because denying things on paper is easy. But once your doctor is having an actual conversation with a doctor at your insurance company, that's a whole different ballgame, right? They're comparing apples to apples. There's they can reason with each other. So I would say a peer-to-peer, definitely get your doctor involved. Whenever I do appeals, I've always got a letter of medical necessity from the doctor. But you should get a letter that says why a specific treatment or service is not covered, and you want to argue that specific reason that they put in there. Almost like a court case, like you're going to battle.
Man.
It's a lot of work.
I haven't talked to doctors about this, but I can only imagine this takes them away from like their expertise
Totally.
in seeing patients in clinic, and
Yeah.
it's like one more headache.
One more headache.
Why have we set up the system this way? This is
It's
like
horrible.
beyond
It's a
me.
horrible system. It's an absolute horrible system, and it is nearly impossible for patients to navigate on their own.
Welcome to healthcare here.
Yeah, it's horrible.
So now that my blood pressure is rising,
I know.
what steps and words of wisdom can you leave with the patient who's just listening to this now and is like, okay, I might fall into like Laura's bucket of, the bill comes in, I throw out half of the bill, then I just pay it because I never want to see it again. And then there's people who are, I have the bill, I'm going to put it into the shoebox and deal with it later because I have too many other decisions I have to make in the short term. What are like these empowerment techniques or best practices that you can advise us on right now that we can take place immediately?
Sure. I would say if you've got the wherewithal, like if you are physically and mentally able to create yourself a spreadsheet of every bill that's coming in, did I pull up the explanation of benefits and everything looks cool? Did I pay this bill? If you can start tracking all that stuff, and then you should have a running total of how much of your deductible have you met then? How much of your out-of-pocket max have you met? And if you go over that out-of-pocket max, you've got a problem somewhere along the line, like something didn't happen as it should have. If you're too overwhelmed with it, see if you can enlist a caregiver, a friend, a family member to take it on for you, because those bills aren't going to go away. So when you put them in the shoebox and wait for later, you're going to get sent to collections. They don't just go away. So I would say, and if there are denials, those are easier to fight when they've just happened as well. So let's just say even you go in for an MRI and all of a sudden you've got a bill and the explanation of benefits says it was denied because you didn't get prior authorization. Well, if you do something soon about it, you can maybe get a retro authorization and get that MRI covered. So throwing them in the box is only going to create problems. And I would say deal with it or have someone deal with it for you as you go along. It'll save you a lot of headaches.
And I think that's the other like overwhelming piece. Like, how am I supposed to know that I needed prior authorization? I am just
Exactly.
following what my doctor is telling me. I am showing up at the date and time and the location that you're telling me.
Yes.
I want to take a quick moment and tell you something I'm really excited about. You can now download the survivingbreastcancer.org app directly from the App Store or Google Play. Just search for survivingbreastcancer.org. It is completely free to download, and inside you will have access to all of our support groups, educational programs and webinars, all of our blog content and articles, podcast episodes, and community features to connect with others who understand what you're going through. Everything in one place, because navigating breast cancer shouldn't require 15 open browser tabs. Download the app today.
I would almost assume, this is going to sound horrible and overwhelming, I would almost assume that everything needs prior auth just to cover yourself. And so be asking your doctor, did you find out if this requires prior authorization? If so, did you get a prior authorization number? Whether that's for a medication or an MRI or a CT scan or a surgery. The other thing that you really need to pay attention to, and this has been a part of a few groups of advocates where we talk about our cases and what do we have going on. And what keeps coming up is a doctor's office will call a patient's insurance and say, does this procedure require prior authorization? And the company will say, no, it doesn't. Great. Or maybe they say, yes, it does. Okay, we'll go ahead and get it. What they failed to ask was, is this a covered procedure? Okay. And so then you've got this prior authorization number. And if you read the letter that comes with it, it says this is not a guarantee of payment and it all depends on your benefits at the time services are rendered. So I have people that have actual prior authorization letters in their hands approved, but the claim is denied because the procedure was never a covered benefit in the first place. So that's super confusing, right? If I could get out there and blast it on social media or I don't know where, the providers and patients need to be asking first, is this a covered benefit under my plan? And if so, does it require prior authorization? It's like the questions either aren't being answered about the coverage or, things are going backwards. We need to first find out if it's covered. Yeah. And here's an example. So when I managed the OB practice, I would call and say, this patient's scheduled for a hysterectomy. Is this a covered benefit under her plan? Yes or no? Okay. They give me, yes, it is. Okay. Does it require prior authorization? If it's not a covered benefit, who cares about the prior authorization question, right? We got to find out if it's covered first. And so I've got all these people now with these huge bills thinking that they were going to be covered and they're not. Yeah. So it's just one more thing to make it, difficult, I guess.
And so if things aren't covered under our plan, do we look for new plans?
Well,
are we just stuck and out of luck?
I think it kind of depends. So a lot of them, and I can think of one right now, a breast reduction. Just,
yes,
no history of cancer or anything like that. Just very large breasts going in for a breast reduction. The doctor called and got a prior authorization, but didn't ask if it was a covered benefit. And I immediately, once the patient reached out to me, I was like, okay, I need to get my hand on your plan benefits, like that detailed book that says what's covered and what's not. And a lot of times, if you're covered through an employer plan, it's up to the employer to decide what they're going to cover and what they're not, right? We've all heard of employers who cover birth control and some don't, or whatever, fertility treatment and some don't. Well, in this case, her provider, it said right there in the booklet, reduction mammoplasty is not a covered benefit. So it was right there in the plan. But again, the doctor's office called and said, does this procedure require prior authorization? And they said, yes, they got it. And of course, the letter says, yeah, but.
So we need to be able to not just know the questions, but how to phrase and ask the questions in the order in which we should be asking questions.
Yes. And I always tell people there's nothing I'm going to do for you as an independent patient advocate that you couldn't ultimately do for yourself. It's just knowing what to ask, what to look for. It's just like a tax accountant. I could do my taxes myself, right? But I'd probably end up in jail, or at the very least, I would not be getting as much money back as I should. People can do it themselves, but especially when you've got a big diagnosis like this and you're so overwhelmed, it's just too much. Yeah. So I would say, what can we do? We can ask for pricing up front. Definitely push back when you see a denial. I would say if you have a medication that you have determined, it's not going to be covered, but my doctor says this is my best chance at survival, go out and research that drug, because a lot of times the manufacturers will have rebates or financial assistance programs, and the oncology practices should be aware of some of that stuff too. Financial assistance through the hospitals, just go out there and see what's out there. If you get to the point where, because we've talked about people with insurance, and yes, that's hard enough, right? If you get stuck with $10,000 a year, but then you've got this population of people who doesn't qualify for Medicaid because they make too much money for that, but they don't have health insurance, or maybe they do, but they can't even afford a $500 bill, let alone, a $5,000 bill. There is crowdfunding. So everybody sees GoFundMe, right? And I do not recommend that at all for medical expenses, but there are legitimate crowdfunding sources out there just for healthcare. And one of them that I recommend a lot is Help Hope Live. So it's helphopelive.org. And you would set up a campaign and you would say, my name's Jenni. I've just been diagnosed with breast cancer and I've got no health insurance, whatever your scenario is. You send it out there and I can donate to your cause, but Help Hope Live is a nonprofit and they are holding all that money. So my donation is tax deductible for me, which I don't know about you, but my husband loves it if all my donations are tax deductible. Like giving to somebody's GoFundMe is not. Plus, you don't know if the GoFundMe account is going to be used, to make a trip to Disney World, at the spa, or on your bills, right? Hope Lives makes sure that those funds are only going toward your medical expenses. So I love that. If people get to that point, a lot of people don't like to ask for money for these things, but
it's hard, but
it is hard.
It's reality, and people just want to help.
Reality. Yeah. It's where we are.
And how can people find you if our listeners are like, oh my gosh, I need help navigating not only my bills, but these claims and these denials and these spreadsheets? How do people find you?
Well, you can Google me, Jenni Nolan. My boys have pointed out that I am actually Googleable. So if all else fails, Jenni Nolan. And then my website is clearhealthcareadvocacy.com. You can also find me listed on different advocacy websites. Greater National Advocates is a great resource. That's also a great resource for people who are looking more for the clinical side, like we talked about. Like, oh my gosh, I've just had this diagnosis. I need someone to help me just coordinate care. That's a great place to find advocates. We're all over the country. As far as helping people on the financial end, I've got clients in Alaska, clients in New York City. So anywhere in the United States, if you're doing clinical advocacy, I don't know, you might want someone closer to home. It just depends on the situation. But yeah, and then Facebook and Instagram, I try to stay up to date on there, although I'm so busy with my work that I'm not keeping it up like I should. But
amazing. And Jenni with an I.
If your listeners want to, my website at clearhealthcareadvocacy.com, I do have a little DIY kind of summarizes everything that we talked about, going through the process, so they can download that.
Fantastic. And I'll be sure to link to your website and all of these great resources that you mentioned in our show notes so people can access it. Thanks for sharing your knowledge with us today.
Thanks for having me.
And thank you, everyone, for listening to our show. I would like to acknowledge that all of the information on our podcast is from personal experiences and is not a substitute for professional medical advice. You should always contact your medical care team. If you are looking for specific topics or would like to be a guest on our show, please feel free to reach out. My email is laura@survivingbreastcancer.org. Our show is made possible by our nonprofit, survivingbreastcancer.org, and by our incredible donors like yourself. You can hop on over to survivingbreastcancer.org to sign up for our mailing list, make a donation, and explore the 400+ programs we offer each year at survivingbreastcancer.org/events. Until next time, keep on thriving.